Hello, everyone, and welcome back to the Outcomes Rocket. I'm excited to have you with us today for another outstanding episode because today I've got the privilege of hosting David Dyke on the podcast. He is the Chief Product Officer at Relatient. He's got over 25 years of product, R&D, and commercial experience across many health verticals, including patient access, revenue cycle, clinical research, health information management. He's passionate about helping healthcare organizations achieve their full potential while positively impacting the lives of people in their communities. And they're doing a brilliant job of that at Relatient. If you guys haven't heard about the company, you're going to hear about them today. So David, such a pleasure to have you here with us.
Thank you, Saul. Appreciate that warm introduction. And I've always been nice to be lumped into people who are doing brilliant things. So thank you for that.
Awesome, man. Well, look, in today's age of AI, the role of product leader is more important than ever, not only from a differentiation standpoint, but sea of sameness is such a thing right now.
Absolutely.
So I'm excited to dig in with you. But tell us a little bit about Relatient before we get into more on that front.
Sure. We have what we believe to be a very simple objective, and that is to simplify the healthcare experience. We do that with a focus on intelligent patient access. And one of the things that I love most about being at Relatient is that we've been talking about intelligence and access long before the A sat in front of the I. And we'll talk about AI and other tools, right, to help improve that patient access journey. But ours really begins with the fact that consuming healthcare in the United States is really complicated. And we're often compared, and people ask us, David, how come scheduling an appointment with my doctor isn't as easy as getting a table with a booking app? I said, well, it's different because it's a lot more important, candidly, right? There's a lot more at stake. And the simplicity of getting a table doesn't need to know, have you been here before? What did you eat yesterday? How are you going to pay? Is it the same way you paid the times you were here before? And for those of you who may have heard me talk before, this is a sort of a setup that I've used a lot because the analogy is really powerful in the sense of, as consumers, we want that healthcare experience to be as retail-like as possible. And we want it to be as frictionless as possible. Yeah. And the dynamics of the US healthcare system are working against that, right? It's a third-party payer system in a lot of cases. It's a first-party expensive, massively expensive out-of-pocket experience in a lot of ways. And capacity exceeds, or demand outpaces capacity, 3-to-1, 10-to-1 in a lot of areas. Metro areas are very different than rural areas. So, healthcare is massively local. And one of the things that we've focused on as a business is how do we take the organizational intelligence that any given healthcare practice, organization, multi-specialty, single organization, multi-state organization has in how they want to run their business, and codify that and implement that in a way that it can be used through a lot of different channels. Patients doing it themselves online, patients interacting with a voice agent service, schedulers doing their best and operating at the top of their skill sets every time and making as few errors as possible. And that intelligence really is the core of our platform. It's the core of our business model, really, is to be able to bring that intelligence together, put a platform together around it, and allow our customers to make use of it whenever and however they need to for what's best for them.
Yeah, no, I love that, David. And, I really love that you made that distinction about like booking a table at a restaurant. Sure, we talk about let's bring the Amazon and the Starbucks experience to healthcare, right?
Right.
But it's not that easy. And I'm glad that you went there, especially as a product guy, right? You're focused on all of the details that go into this appointment.
Yeah, I love to use the reference of a capital P product, which is kind of in the math context, right? The sum of the equation, right? It's all of the parts of the experience. It's not just the screens. It's not just the integrations. It's not just the backups and the certifications and the high trust and those sorts of things, but it's the totality of those things as a product. How do we build something that our customers can use? And one of the product lessons that was imparted on me a long time ago is that when I think about my product, not from my perspective, but from the perspective of my customer to their customer in this B2B2C model that we're talking about here, it really does change how we approach product design. And I'm really proud of the fact that we've done a lot of direct research with consumers on how they want their experiences to be handled. We do a lot of direct research with provider organizations who are our customers and who are not our customers around want referrals to be improved or how waitlisting can be done. And so all of those things are sort of the core jobs to be done for which a modality like a conversational AI may be appropriate. A website experience may be appropriate. Text messaging may be appropriate. How do we think about all of those different modalities, those different touch points cohesively so that we're bringing one solution to market and not selling you a whole bunch of silverware that doesn't match at the end of the day, right?
Amen to that. Yeah. That integrated experience, the thoughtful user experience is key. So you mentioned voice AI. How's voice AI, like Relations Dash, changing the way patients interact with providers? And I think a lot of people know Dash, but for those that don't, tell us what Dash is and tell us about how this voice AI is changing the way patients interact with providers.
Yeah, Dash is the name of our intelligent access platform, right? We use it to do real-time integration to a variety of the leading practice management systems out there. We use it to create and update patients in real time, to create and update appointments, to create and update cases, notes. And I like to describe it as we are not the source of truth, right? The practice management EMR system is the source of truth, but we are a trusted reader and author of truth. And that distinction allows us to create some really clear ground rules around how we interact with a system, how we interact between the differences of, say, an ECW system that acts one way and an Athena practice system that works another way, and a ModMed practice that works a different way. They're all distinct, right? And they all have their own walled garden models around them. And so our ability to integrate with them in an intelligent way allows us to put together workflows that support that customer's goals. And when we go to market with our solution, we like to start with a goals first approach. What are you trying to do better? What are you trying to accomplish? And again, I think that's the root of any good product, which is to start with your customer in mind and to start with that problem in mind that you're trying to solve. And candidly, I think a lot of your guests have talked about that. Nikhil recently talking about workflows with AI, that workflow matters most. And we're following the exact same principle here, that workflow is what matters first. And if we can improve it through AI, great. That's a tool, that's a method. If we can improve it more effectively with a text message, let's do that. It's a much more cost-effective experience. It's ubiquitous. Everybody has a phone. 99.9% of us have a phone that will text. And so let's use those kinds of lower friction, lower cost, more efficient ways to handle it. And if AI is the right thing to do, like call deflection, how do we take high volume, low value activities out of the hands of having to be human-based? That's the only way you can do it. Right. And going back to the math reference, I like to kind of think about the time something takes as the numerator over the value of that activity as the denominator. And when that fraction is 1/3, that means I'm spending $1 to get $3 worth of return, right? Effectively, that's a good one. If it's 3/1, that's a horrible equation, right? I'm spending $3 to do a $1 activity. And that's why we started with our voice AI, which is let's take the high volume, low value things. And just as one of your other guests mentioned, at Health this year, 2 years ago, no one had AI in the whole building. And this year, everyone had AI somewhere on their wall, if not 3 times.
Everywhere.
This AI concept has really come on in healthcare like nothing I've ever seen in 20, 30 years, maybe since the internet did. And to move that quickly, especially in things like this, access is a front of house activity. And it's great to experiment with ambient AI and other things that are listening and passive and that you can deal with and dial in behind the scenes. But when you put AI in front of your patients first day, they notice, right? And interestingly enough, you and I are people who are technology lean in kind of folks. But say in an orthopedic practice, like where my dad goes, the average patient in those groups is over 60. The average, like it's 70%. In a lot of our cases, 70% of their patients are over 60 years old. And those folks have been trained over the last 20, 30 years that automated phone systems are garbage. And the opt-out rates are incredible. So if you don't design a system that anticipates that opt-out process, put strategies in place to help retain people, coach people along the way, basically having AI train your callers, that I'm a good AI, I can help you with these things. Are you sure you'd like me to transfer you? There's a hold time over there. I don't have one. Here's the things I can do. Those things take a little bit more time, but there's a lot of market education that needs to be done in these tools. And I think that's one of the areas that sets Relation apart, is that we have award-winning patient-facing tools and we have new AI capabilities, and we're linking those together, right? Steer the patient to the lowest friction, easiest to adopt methodology, because very few people, probably you and I included, have the patience to spend 3, 5, 7 minutes talking to an AI system when I'm a brand new patient starting from scratch.
Yep.
And practices that we talk to generally fall into two camps. So I want the AI to do everything. And then there's I want that first time caller to have a concierge experience, and I want them to talk to my best people. And I want my best people to have as much availability as possible. And I want low hold time so that those people can get right in. And so that's where AI can come in and say, what I really heard you say is you have a hold time problem, right? So let's look at volume. Let's look at capacity. Let's look at talk time. How do I use concepts like warm transfer to reduce talk time for jobs the AI isn't doing, but can help accelerate by collecting all the raw materials to do that? How do I steer people to an online experience that they may not be aware of, that they can use next time and help reduce total call volume over time? And I think when we think about those kinds of approaches of balancing AI as a tool, as opposed to thinking about it as an answer, it's a much better outcome for folks. I was telling someone this morning as I was kind of sharing my prep for being on your show, I said, it's easy for people to get drunk on the A. You get drunk on that excitement of what the artificial is so amazing and what it can do. But man, that I can really give you a hangover if it isn't done right. And I told him this morning, I said, I'm not sure if I can pull off that analogy or if I even want to, but I felt it was right. That you get drunk on the A, but that I is going to cost you in the morning if you didn't do it right, because those edge cases will burn you. Healthcare is not open table. Healthcare is not Starbucks. If a latte costs $35,000, which is what the estimate that my brother got this week for a foot surgery, the Starbucks experience would be very different.
Yeah. No, that's great, man. I like the analogy, by the way. You pulled it off.
Good. Thank you.
You pulled it off. I think we could do a part 2 to this on the data side of things, but I think now more than ever, Dave, the problem we have with accurate data has been exacerbated with AI. You care to comment on that?
Yeah, I've often joked, as I'm prone to do about healthcare, is that we talk a lot about integration, but the real problem is outegration. I need to get data out of those systems that have the walled garden. I need to be able to interact with them effectively. And we're not alone in this problem, right? People are still using RPA activities, right? Screen scraping to navigate systems, especially those that may not have had to be upgraded for meaningful use, that don't have an API structure. So in areas where we can do deep integration, not just at the patient level, at the medical record level, at the clinical communication level, at the history level, we can do and are doing incredible things with AI to help do basically the productivity improvements, right, that people are looking for in these solutions. And we have the data to prove it, right? We see reduction in total hold times. We see patient opting in to using digital tools as part of a self-service scheduling activity. We see patients opting into staying with the AI and saying, okay, I'll learn from you. I'll figure out how to do it because it's a constructive experience. And when I mentioned that kind of front of house problem, another thing that the data shows us is that this isn't about affecting up to 100% of your patients. This is really affecting 200 to 300% of your patients because of the number of people who called in multiple times. A third to 45% of appointments are changed after they're created. So that's 140% of the people who are going to call, right? 100% had to call to get the appointment created to begin with, in fact, in theory. And another 30 to 40% are going to call to change it. And if there's a 5-minute hold time the first time and a 7-minute hold time the second time and a 13-minute hold time the third time that's call, that's a cumulative effect on your customers that this kind of tool, and again, not a single channel tool, but this kind of tool can help improve that overall patient experience and also open you up to 24-hour service availability. And here's the things they can do after hours when these practices are typically closed. So consuming healthcare in the United States is not easy. It's a complicated thing to do. And that's really, I think, what drives our mission, right? Coming back to that is to simplify healthcare. And we're not trying to solve every point on the compass. We're really focused on access specifically for now. And there's still a lot of work to do.
I really appreciate that, David. And I appreciate you jumping on the podcast today to tell us a little bit more about the work that you and the team at Relatient do, the Dash platform, and how you're changing how providers can onboard patients, the patient experience overall. Lots of progress, still lots to be done. If people want to learn more about you and the company, what's the best place they can reach out to connect with you on the product side or the sales team on the sales side?
The best place to reach us is at relatient.com. And sure there'll be links to that in the show notes. But relatient.com, we've got a great website. We're very, very honored to serve a lot of really creative, innovative healthcare organizations across the country. So there's probably an organization near you that's using Dash. And hopefully you have an opportunity without any specific real urgency or need to book your appointments and make your manager experience increasingly online and through new channels like some of our partners are doing.
Listen, David. Yeah. And by the way, folks, like I go to many of the conferences, and not just on one occasion, on several occasions, I've actually heard from practice leaders talk about the Dash platform, and people
That's
seem
awesome.
to be thrilled about what you guys have over there. So I want to give you kudos because the market speaks for itself.
Thank you.
On what you and the team are doing for the product and for your customers. Folks, there you have it. In the show notes, you'll find, as David said, how to get in touch with him and the folks at Relatient. Again, David Dyke with us today. He's the Chief Product Officer at the company. Just a brilliant mind in the space, and so glad that he could join us. Make sure you get in touch. And David, thanks for spending the time to be with us today.
Thank you, Saul, and thanks for having me on the rocket.